Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I'm joined this evening with Anu. Anu, please introduce yourself.
Hi, so my name is Anu Cheemarla. I am currently an administrative fellow at Cincinnati Children's Hospital and Medical Center. I got my master's in healthcare administration from the University of Illinois Chicago and my undergraduate degree in environmental health from the University of Georgia. I'm very excited to be here.
We're very excited to have you. You have a great career with different kind of aspects to it,
Mhm.
and it's all culminating right now with your fellowship, of course. So I want to start back during the actual undergrad and talk about that environmental health degree. What
Mhm.
caused you to get that? What were you interested in that led you to get that degree?
Yeah, so when I initially started my healthcare journey, I feel like this might be similar for a lot of people, but you kind of start in the medicine track, either pre med, things like that. So that's kind of where I started. And public health was an area that I was interested in. So I did the environmental health slash public health pre medicine track at the University of Georgia. But halfway through getting my undergraduate degree, I realized that that wasn't really the space that I wanted to be in the sense that I didn't want to be a physician, but I knew that I still wanted to work in that healthcare, health equity space. So, post undergrad, I worked for the Georgia Department of Public Health, where I tapped into that environmental health and a little bit of the population health stuff that I learned in my undergrad degree. But from that experience, I really learned that to further my career, I knew I wanted to stay within healthcare, and healthcare administration would kind of be the place that I could make my way through my career path and kind of grow.
And so I want to ask the MHA program, did it pose any challenges? Specifically, I'm thinking in the finance area,
Mhm.
because, that's a little bit different than the environmental health, right?
It is. It definitely is. And a lot of my peers did come from like an MBA or a business sort of background. So it was interesting kind of maneuvering that. For example, when I started my master's program, I didn't have a LinkedIn. So, but a lot of
Okay.
other people in my cohort had LinkedIns. They already had like 200 plus connections, things like that. So I really started from the beginning because I was that pre med track, like I mentioned. But I think with my background in environmental health. And one thing about my specific MHA, which is so nice, is that it was situated in the College of Public Health at UIC. So a lot of the courses that we took still had that public health, health equity focus. Like we still took biostatistics, we still took classes around like epidemiology, things like that. So there was that focus as well. But the financial aspect and of course like the business aspect of the my MHA was definitely the most challenging area for me. But I think with the proper guidance and teachers, and I also had a great cohort with friends, I was able to maneuver it and be okay. So you can start in one place and still be completely fine in another.
Very good advice as well,
Mhm.
because we want to make sure that, people, one of the big things is we just need this industry to be more diverse. And I'm not just talking about, race or gender, but also diverse experiences, diverse backgrounds. You want people from all walks of life to come in and be part of healthcare administration. So I love how you're saying you can start in one area and then you can still succeed. And one on that note, one of the important questions, you said you didn't have a LinkedIn coming into,
Mhm.
this. How have you done that with connections? How have you done with this? Is a different kind of networking, right? We're not so much shadowing like, when I was a pre-med, similar to yourself, you probably did lots of shadowing, lots of things like that. The
Mhm.
connections with administration are a bit different. What challenges have you overcome with that change?
I think one of the biggest challenges for me was definitely networking, especially as an early careerist and someone that was younger doing their master's. It was definitely something that I kind of had to push myself to do. But at the end of the day, in areas like the different networking events that CHEF, the Chicago Healthcare Executive Forum, it's ACHE Chicago chapter, they had different networking events that were student specific. So I think those types of spaces and taking advantage of that, especially when you are a student, is really important to build that networking background and build that foundation for when you kind of want to do more in your career. And it really helped a lot for me as well, like coming from that STEM background and not having done that before, just kind of starting at level one and first starting maybe with like networking with a friend, like going with someone to kind of that you can talk to if you're feeling a little overwhelmed, or someone that you can be like, okay, we will both approach this person and talk to them together. I think kind of starting at one spot and then working your way up to those more higher level, executive level networking events was the way that I went about it. And I think that really helped with kind of overcoming that sort of situation for me.
Absolutely, absolutely. It's crazy too with COVID. You're not doing the in-person networking as much, and so
Mhm.
I did some networking, but when that started being over and we started really going into it, I was very nervous going into a lot of these things. So it was just, finding the kinds of events and situations that made me most comfortable. So then I wanted to kind of talk about one of the interesting things is this contact tracing position that you've
Mhm.
had. Can you tell me about how you ended up getting that? Because it's actually a supervisory role, right?
Yes, it was. Actually, it's a funny story. And I think with any time in your career when like you work as hard as you can and someone believes in you, that really helps push you forward. So for me, I actually started just as a contact tracer on the team right when COVID was at its peak. So I believe it was like April of 2020. So it was a lot of hard work. And there were days that I would also have to go into the office. And I think my supervisor at the time saw how dedicated I was to continuing to work as hard as I can and just trying to make those calls and make those connections with people and provide any sort of care that I was able to provide. So when she transitioned into a role with the CDC, she asked if I would like to step into the role of supervising the team. And that was within like 2 months of me starting as a contact tracer. So I think not only the fact that I'd been with the team since its fruition, essentially, and then also kind of showing up from day one really helped with pushing, kind of bringing like the start of my career, and then has been growing since.
I mean, congratulations on that success. That's incredible that people see that drive that you have. Did it pose any challenges being a supervisor specifically? Because I assume was that one of your first kind of leadership roles?
It was my first one. It was right out of undergrad, so it was definitely tough. I think because the team that I worked with, they were actually all older, so I was one of the youngest people, but they were all such great people that they really respected me, and I always was able to be like a good manager, supervisor. So I think like we had that mutual respect. There was one little situation, and I think that women do face this sometimes in the workforce, especially as a younger woman in a certain career situation. There can be older men that can be a little more restrictive, or they can try to push you down, things like that. And I think the best way to go about it is to just continue to work as hard as you can. And then once it gets to a certain point, definitely talking to whoever is your manager, your supervisor, and bringing it up and being like, hey, this is a situation that I'm not personally comfortable with. Like, do you mind either stepping in, intervening, or like taking whatever necessary steps to help me through this? And after going to my manager with this issue that I was having with a coworker, it was totally resolved within the next week. So I think there are times as a woman, especially a younger woman or a woman of color, that you do face these types of things in any area, not just within healthcare or healthcare administration. But usually you have someone that you can trust, that you can go to for advice and support.
My wife has faced similar problems, so I
Mhm.
want to ask if you're comfortable with sharing.
Mhm.
When you before you go to your supervisor or before you discuss things with your coworker, what kind
Mhm.
of mental preparation are you doing?
Yeah, I think mental preparation wise, for me, when I was going through it, like whatever feelings you're feeling within that moment are completely valid. I think at the time I felt as though maybe this is just this one instance and this treatment will go away after X amount of time. Like that usually doesn't happen. And being candid with the person that you are kind of facing this issue with and being like, hey, like this is not a comfortable space for me. So I'm going to be reaching out to our supervisor to help mediate going forward is, I think, the best way to go about it. And that's the way that I went about it. I think also sharing what you're kind of going through with a trusted person is important as well, someone kind of removed from the situation. Talking through those issues and those feelings that you're having is also a great way to kind of navigate what you want to do next. And then I think for people like you, I think like asking these types of questions and having these conversations is the best thing that you can do to learn more and grow and kind of align yourself as an ally with these different groups. And like for me, I think that's something that I really love about like working at Cincinnati Children's right now. It's an area where diversity, equity, and inclusion are so celebrated, and not just by, you know, the DEI office here, but like by everybody at the institution, and it's so integrated in everything that happens. So I think there are ways that like as a person, you can continue to align yourself with those spaces. Like, for example, at Children's, we have these different employee resource groups, and there's one that's specifically for women. It's called WISE, but not just women are there. Like, there are also men that are listening to those stories and that are there to help and to just lend an ear or a helping hand, things like that. So I think just growing and being an ally in those spaces is just as important as like doing that internal work.
Thank you for sharing that. And thank you for sharing that personal kind of story as well. So I noticed that you first had an internship at a children's hospital, and then you had a fellowship at, at the children's hospital. Did you
Mhm.
always, want to work within a children's hospital, and what are some reasons for that?
Yeah, so when I was in high school, I was actually a volunteer at Children's of Atlanta, and I've also volunteered in adult healthcare spaces as well. But I just love working at children's hospitals. Being able to impact the life of a child in any sort of way is so inspiring to me and kind of motivates me to continue to do the work that I do. So my internship at Lurie was the first experience I had with hospital administration in a pediatric environment. And I think that kind of helped fuel my fellowship journey and my applications for different programs. And most of my applications were actually in the pediatric space because I knew that that was an area where I wanted to stay and where I wanted to grow my career. And one thing about PEDS that I really love too is that all of the administrators that I've met with, both at Lurie and at Cincinnati Children's, have just been so welcoming and kind and ready to give advice. And they're so eager to like help young minds and to help you figure out what you want to do with your career, things like that. And I can't say I've had as much experience in the adult space, but with peds, I think there's this culture of compassion that I really love and that I want to continue to grow my career in.
That's really nice. So when you had these great experiences, what was the application process like for the fellowship? How many programs did you apply to, and were you specifically targeting the pediatric institutions?
Yeah, so I applied to around 15 fellowships. I was in Chicago at the time, so I applied to most of the fellowships in the Chicagoland area that I was interested in. And then outside of Chicago, I mostly applied to only pediatric fellowships. So I knew that peds was kind of the area that I wanted to stay in with my career.
And so I assume you're pretty happy with the way it turned out.
Yes, I'm very happy. I got my number one choice, so I could not be more grateful.
And so tell me about, if you don't mind, why this was your number one choice, and then what it's been like working there, what the environment. I mean, you've already alluded to it a bit, but just kind of go through all the different reasons.
Yeah, so I think with fellowships, it's definitely like you are applying for a job. So you are putting your best foot forward, but at the same time, you're interviewing them as much as they're interviewing you. And with my interview with Cincinnati Children's, right off the bat, I knew that the people that I was talking to were people that I wanted to continue to talk to. They were very welcoming, they were very kind, and I can't say that other interviews that I had were the same. Like you can just kind of tell with fit. And it's the same thing for them. They can also tell with fit on the fellow side. So for me, when going through that interview process, I think I not only could tell by the personalities of the interviewers that I was talking to, but also just the mission that Cincinnati Children's has and their key areas that they want to grow in. So one thing that I'm specifically passionate about is pediatric behavioral health and mental health.
Mhm.
And Cincinnati Children's is the largest provider of behavioral health services for peds in the country. So I think those aspects of the fellowship too, like the values of the institution aligning with my own values, was something that I was really excited about as well. And Cincinnati Children's is also number one in the country. So the best place to learn.
Helps.
Yeah, it does. It does.
Is it a Yeah? Is it a 1 or 2 year? You already told me this, but I want to.
It's a 1 year. So
So
our
it's a 1 year.
fellowship, it's a 1 year fellowship, yes. And I think one thing that I forgot to mention with the previous question was like the spaces of like that I specifically enjoy at Cincinnati Children's. And one thing with Children's that I really love is those ERGs that I mentioned, the employee resource groups. They
Mhm.
are in the Diversity, Equity, and Inclusion Office, which is where the fellowship is situated as well. And I've just never been in any work environment that's been as inclusive as this hospital is. For example, like I'm Indian and I'm Hindu, and Diwali is a celebration that we have in
That's
November.
nice.
And
Celebrate
Cincinnati
that?
Children's, yeah, they have such a large celebration for Diwali in Sabin, and there were dances, and they had cultural food, and
Wow.
all of the employees were dressed up in like Indian attire or like Pakistani attire, just desi attire, and it was just so cool to see that at a workplace, like people like VPs taking time out of their day to come down and be a part of those cultural celebrations. So I think like not only are they the leader in providing pediatric care for kids, but there's also just this compassion that they have for their employees and creating a safe space that's really nice too.
I've only heard of one other institution that I've spoken with someone from so far out in California who
Mhm.
had that same policy regarding the celebration of these holidays. And it's so important to me. That's one of the biggest things I was telling them. Like, I really want to work for somewhere that does that.
Mhm.
That's incredible. Wow, really nice. Thanks for sharing that. I love that. You're almost done with this fellowship. What are some of the highlights, whether it's projects or people you've worked with? What are some of the highlights of it, and then what are you looking to do next?
Yeah, so I think some highlights with this fellowship, it's really what you make of it. So a lot of the projects that me and my co-fellows are doing, we are the ones leading them. We are the project managers for these projects. So we have a lot of autonomy with the fellowship and where it goes. And I really enjoy that. I think as an early careerist, kind of navigating what you want to do and being able to show that, you are able to handle these high level tasks is really important because some ways that people describe fellowships is kind of like a year long or a 2 year long interview. So taking that time to be in those leadership roles, even if it's just for one project or two projects, is really cool and something that I was really excited about before I came here for the fellowship. One thing that I'm excited about with the my future career as well is the support that we have from Cincinnati Children's with wanting to retain us. So most, I think there's still 17 alumni fellows at the hospital. So most, if not all, fellows have been offered a full-time position post fellowship. So they really want to retain us. And it's apparent with how my mentor talks to me, how other mentors talk to their fellows, and how they kind of want us to succeed in any way that we can. And yeah, it's just been a wonderful experience. I'm excited for the future of my career and potentially, hopefully, continuing to grow it at Cincinnati Children's. Another thing, too, that was really fun about our fellowship experience is that when we started, we had a lot of conversations with the different executives and VPs, things like that. And that's pretty analogous for most people at other fellowships. That's kind of how it goes. But we were able to tour the helipad. We were able to tour the different ambulances. We were able to do so much fun stuff. And it was just because we asked. Like, if there wasn't any rhyme or reason to it, I was just like, hey, would it be possible for us to go look up at the helipad? And my preceptor was like, we can do that. So I don't know. It's so unique. Like being a fellow, you get such different experiences that other people at the institution aren't able to get. And I don't know. It's just been wonderful so far.
That is wonderful, and I'm so happy for you. That sounds like a wonderful experience. So congratulations on that.
Thank
Do you
you.
have any, as a kind of a final thought,
Mhm.
any tips that you've learned through your experiences that really stand out that you want to share to the younger, earlier individuals? One or two things that you've learned that have really been meaningful for your experiences.
Yeah, I think one of the main things with any work that you do in healthcare administration is listening to the voice of the frontline first and foremost with any project that you do. I'm involved in a few different projects that have operational components. And even at Lurie Children's, I was involved in a few different projects that had those sorts of components. And I think making sure that you have the people that are going to be doing the work as the primary people that you are talking to when you're making any sorts of plans or decisions, things like that, is the most important thing. And getting that feedback, I would go into meetings so excited, like this is a great idea, this is what we should do. And a nursing leader would be like, there is no way that'll work. So that stuff does happen and you do feel a little bummed out, but at the same time looking at it and being like, okay, so how do we go about making this better is something that I've learned throughout my career and something that does happen, but you just kind of have to pivot and keep going. So I think making sure to involve the people that are involved in the processes that you're working on is one of the most important things to do. And then if you do face any sort of, I wouldn't even call it rejection. I guess it's more of like a pivot. Like that's completely fine. It happens and that's just life and work, unfortunately, but you just grow and you keep going.
And I develop this plan, I think it's really great, and somebody says, oh, we're not doing that. It's like, oh man. So I still struggle with that. One last follow-up question for you.
Mhm.
How have you succeeded in identifying these stakeholders you're talking about,
Mhm.
especially in complex clinical environments? It's, coming from a non-clinician, I guess it's not always easy for me to identify who should I talk to. So what's your method for doing that?
I think the best way that I've been able to do that is whenever I meet with someone and we talk through what this project or this process change, whatever it's going to be, I'm like, who else do you think would be a good person I should reach out to? Or who else is involved in this process? Or if this area is involved, who's the best person in that area that I should reach out to? And kind of just going about it that way. And another thing about the fellowship that's so great is that like you have a mentor that you can go to who has made those connections and has a history at the organization. So if I ever hit any sort of roadblock, I usually go to my preceptor and I'm like, I don't know, like, who should I talk to about this aspect of this project? And she's like, this person is your go to. And even if they don't know exactly how to help me, they'll be able to direct me in the right place. So it's a lot of searching, but usually people are more than willing to talk to you and they're willing to point you in the right direction.
Excellent and excellent advice. Thank you
Mhm.
so much for joining us today. I couldn't be more appreciative.
Thank you.